Welcome to Pediatricks. Common cold. As the name suggests, it is very common and the symptoms are usually cough, cold and fever. There are numerous viruses causing similar spectrum of symptoms. The most commonest one is rhinovirus. Then you've got respiratory syncytial virus, adenovirus, enterovirus, coronavirus, not the 2.0 version, but the old version. Influenza virus, parainfluenza virus, all these viruses cause similar symptoms. And the frequency of these episodes are very common, that it's around 6 to 8 in a year. That is, every 1.5 months you are bound to get a viral infection. And in around 10% of kids, the number may go up to 12 or more. That is, every month you get a fever, cough, cold. And this is very common in play school age group. Even adults get these infections, but it's around 2 to 3 per year. These viruses are transmitted through contaminated hands and small particle aerosols, large particle aerosols, basically inhalational and fomite touching and things like that. Now, why recurrent infections? The symptoms are similar, but the viruses are different. And within viruses, each one have different serotypes. So each serotype can cause infection. And in each serotype, they can come with different antigens. And all these cases, our body fails to identify this particular virus. And each one can cause different infections. And the protection is short term, unlike other infections which cause lifelong or a long-term protection. Now, the symptoms are caused because of damage of nasal epithelium and our body responding to that particular damage of the epithelium. So they try to repair that and cause inflammation of that particular area. So it's basically upper respiratory symptoms. So the symptoms are basically fever, cough, cold, to keep it short. But usually the fever starts on day 1 and goes on up to 7 days. And fever is very common in young children. They can have a little bit of sore throat in the initial days. And nasal obstruction and rhinorrhea starts once the sore throat settles. That is, from day 1 to day 3, they have sore throat. From day 4 to day 7, they have nasal obstruction and rhinorrhea. Along with the nasal obstruction, usually they develop cough as well. And this cough can go on to 10 to 14 days. So, fever, which lasts for a week, sore throat initially, and towards the end, second half of the first week, you get a nasal obstruction and cough. Cough can go on even if the baby recovers from fever and the other symptoms. There may be associated headache, hoarseness of voice, irritability, decreased sleep, loss of appetite, vomiting, diarrhea. So all these things come in hodgepodge, different little bit of symptoms. But basically, fever, cough, cold is the main symptoms that they get. And fever is mostly seen in younger kids. And while examining the child, we see a lot of nasal secretions, and you may see red inflamed tissue within the nose. There may be a slight redness of the eyes. They may feel that their ears are blocked. They may cry because of that. And you may find some lymph nodes over the neck and this region. Most of the time, you need not to do too much of investigation to come to a diagnosis, because this is basically a clinical diagnosis. Now, coming to the treatment part, antiviral drugs to attack the virus is rarely used. There are certain drugs useful in influenza virus infections, but otherwise, most of the cases it's just supportive treatment. Give paracetamol to control fever. If there's nasal congestion, you can use saline nasal drops, and for slightly bigger kids, other nasal decongestants, and very rarely you use oral medicines to decrease the secretions. And if there's severe throat pain, you can again use paracetamol. For cough, most of the time, it's left alone, and usually they recover by themselves. For slightly bigger kids, you may use cough syrups, antihistaminics. And antibiotics have no role in treatment of viral infections. It's like giving food when you're thirsty. Antibiotics is basically against bacteria, and this is caused by virus. So giving antibiotics don't help curing a viral illness. Sometimes it is given when you suspect a secondary bacterial infection. That is usually we expect the fever to settle and the infection to come down by the end of first week, only cough persisting. But if you feel that the fever is persisting or it's increasing, it's probably because of a secondary bacterial infection over the viral infection the baby already had. In that case, antibiotics are indicated, but otherwise antibiotics have no major role. Basically, this can cause infection to the middle ear, infection to the sinuses, and in asthmatic kids, it can cause exacerbation in asthma. But otherwise, it is quite benign conditions, and these recurrent episodes are also not very worrying. Prevention of these infections, probably you have got vaccination only against influenza virus. Influenza virus cause same symptoms, but in slightly higher grade, and you can fall. Even adults can fall sick if you get an influenza virus infection, and sometimes it can go into complications. So influenza virus vaccines are available, but again, as mentioned earlier, a lot of strains are there in influenza virus, so they keep on changing their form and they keep on re-entering our body in different forms. So giving vaccination against all the forms are practically impossible. So what you do is take the most common 4 serotypes in particular season and a vaccine is given. So in kids less than 1 year of age, you give 2 doses and later on it is 1 dose per year, and each dose each year comprises of strains which are prevalent during that particular season. So it is given just before that rainy season time, and it is repeated every year. And in India, it's recommended for kids up to 6 years of age, because the play school time is a period where the kids get recurrent infections. And in countries like US, even adults get this vaccine every year. It's called flu shot there, and they keep on taking flu shots every year to get protection for that particular year from the common strains during that particular year. Allergic rhinitis can mimic recurrent viral infections, but the difference being the running nose, itching, sneezing are the predominant symptoms. Fever is not very predominant in allergic rhinitis. Vasomotor rhinitis, triggered by weather change, spicy food, all these are usually temporary things. Vasomotor rhinitis also can mimic common cold. Foreign body, especially small kids, they poke little things into the nose and they can cause continuous nose block. But the biggest clue towards foreign body is usually the block is on one nose. The other nose is okay. So if you find foul smelling discharge from one nose, continuously blocked one nose, then probably it's a foreign body and you need to take it out. Sinusitis usually will have prolonged symptoms, and it can cause more problems, headache and things like that. So common cold is very common. It can occur up to 10 to 12 episodes per year, and it's usually very benign. You just need to give symptomatic treatment and the kids recover completely. And by 5-6 years, they get recurrent infections and they are immune to most of the viruses. They are prone to get exposed later on. So until then, you can expect these episodes and you don't have to worry about it. Happy parenting.